Hello and a very warm welcome to this special sponsored feature program on CNN IBN. MST presents Act Now on Diabetes. Diabetes is a chronic disorder for which there is no cure. It is a major cause of illness, premature death, and it is responsible for lost productivity in the workforce and high costs in India's health budget. But the good news is that type 2 diabetes can be both prevented and managed. In the next 30 minutes, let's find out more about this condition and the ways to manage it.
India is in the middle of a crucial fight against diabetes. In 2011, India had 62 million people suffering from type 2 diabetes. The nationwide prevalence of diabetes is as high as 9% currently. The International Diabetes Federation predicts that by 2030, India will be home to 100 million diabetics. These statistics are especially alarming since type 2 diabetes is striking Indians as young as 25. In fact, 90% of all diabetics suffer from type 2 diabetes.
Diabetes fundamentally means that our glucose, is not appropriately used up by the body. The function of glucose is to give energy to every cell of our body, and glucose has to get transported, where insulin cannot do the transport of glucose inside every cell for energy, and that is called as type 2 diabetes.
Type 2 diabetes can lead to many complications. It can blind you, affect your kidneys, even give you a heart attack, and in very severe cases, cause diabetic coma. But what is the reason for the recent explosion in diabetes cases?
Modern lifestyle, lack of physical activity, excess inappropriate food habits, and extra fat in our body is leading us to become insulin resistant, and our insulin action is not appropriate, and that's why we are having this huge explosion of diabetes across the world.
Although not surprising in urban areas, the disease is also becoming common in the rural areas, especially in the wealthy southern states. There are telltale signs that you may be diabetic. Recognizing these early is very important.
When the sugar rises very high, if you lose weight, if you urinate too much, if you feel very thirsty, you feel very hungry, these are called as osmotic symptoms. And those are the symptoms when the glucose really goes up.
Simple blood tests could determine if you actually are diabetic.
The blood test which we do for diagnosing diabetes is a fasting blood glucose and 2 hours glucose after giving glucose load of 75 grams or after lunch. And 2 of these values are abnormal, then you have diabetes.
Ignorance about diabetes can be lethal. It needs lifetime behavioral support, lifestyle support, as well as medication support.
We need to control A, B, C, D and E. A is for the 3 months average sugar, B is for blood pressure, C is for cholesterol, D is for diet, E is for exercise.
There you go, very important aspects about diabetes from Dr. Shashank Joshi. And now let me introduce you to our esteemed panel with me in studio. First of all, Dr. V. Mohan, Chairman Dr. Mohan's Diabetes Specialities Center in Chennai. Dr. Subhankar Chaudhary, Professor and Head Department of Endocrinology, IPGMENR and SSKM Hospital, Kolkata. And Dr. Ambarish Mittal, Chairman Endocrinology and Diabetes, Vedanta Medicity. Welcome to the show, gentlemen. Dr. Mohan, first of all, I'll start with you. Type 2 diabetes, is it hereditary?
Yes, type 2 diabetes is largely a hereditary disease, but the problem is that there is an equal component of environment as well. But talking about hereditary, if both your parents have diabetes, the risk is very high. They say up to 90 to 99% risk if both your parents are diabetic. If one parent is diabetic, the risk comes down to 50%, and if some distant relative has it, you still have a risk of about 25%. But the good news is that even if it is hereditary, environment plays a role, and thereby you can still prevent it.
Dr. Chaudhary, how can I reduce my risk of having diabetes?
Yeah, as Dr. Mohan already pointed out, that you do have environmental factors that lead to eventual causation of type 2 diabetes. And so if you are able to control those, you can reduce the risk, may not make it zero. The risk doesn't become zero, but definitely you can reduce it. I mean, what you need to do is have a healthy lifestyle. Eat healthy, be active. Do not allow yourself to get overweight. And apart from that, also try to keep stress under control, whichever way you have.
Dr. Mittal, it is often said that diabetes brings an end to all the good things that are in life. You have to eat healthy, you have to exercise, you have to watch your diet all the time. How true is that?
If you follow the basics in lifestyle, which Dr. Chaudhary alluded to, which would be things you would do in any case to prevent diabetes, which means eating healthy, exercising regularly, getting proper sleep, not allowing your weight to go up or bringing it down if you're overweight, you would probably have a very healthy life. And it is said that those diabetics who follow healthy lifestyles and regular monitoring are many times healthier than even non-diabetics. And I think that's the key point to understand.
Dr. Mohan, what type of complications do we see type 2 diabetes bringing to people?
There are two basic types of complications that patients are prone to. The first is what is called as an acute complication. So a low sugar reaction would come under that, or a diabetic ketoacidosis or coma would come under that. Those are what are called as metabolic complications. And then there is a vascular complications. Vascular complications, we are dealing with the blood vessel now. So diabetes is often called a vascular disease. So again, there are two types of blood vessels. One is what is called as the small blood vessels or the microvascular complications. This can affect the eye, leading to diabetic retinopathy, which is one of the leading causes of blindness today. When the kidney gets affected, then you have diabetic nephropathy, which is again the leading cause of kidney failure in the world today. And then you have the nerves getting affected and therefore neuropathy, leading to loss of sensation and amputations and so on. When it affects the large blood vessels, it primarily affects the heart, so it leads to heart attacks and the people have to go for angioplasty or bypass surgery and so on. It can also affect the brain, leading to strokes. So all these complications of diabetes, luckily, the microvascular complications, the macrovascular complications, as well as the acute metabolic complications, can all be prevented by good control of diabetes.
Dr. Mittal, what is gestational diabetes? And gestational diabetes, does it stay even after pregnancy?
Gestational diabetes is one of the most important areas of diabetes. It is the onset of diabetes for the first time during pregnancy. That is called gestational diabetes. Now, gestational diabetes classically goes away after delivery, but not really. It goes away only to come back very often later in life as type 2 diabetes. And so, as type 2 diabetes has increased in India, so has gestational diabetes. So, for us, gestational diabetes is a very important window to intervene. If you treat it properly, you're preventing problems in the newborn, but not only that, you're also teaching that woman to educate herself about preventing type 2 diabetes later.
Dr. Chaudhary, diabetes in children is heartbreaking. But type 2 diabetes, how does it make these little children its victims? And also towards their adult life, does it get complicated if not managed at the right time?
Yes, I mean, one of the problems of diabetes that we see in our country, also in the Western world, but possibly more in our country, is the younger ages at which we are now seeing type 2 diabetes. We read in textbooks that type 2 diabetes happens in those 40 and above, but we see them very often in 30s, in 20s, and now we are seeing even teenagers getting type 2 diabetes. Obviously, as Dr. Mohan has already mentioned, that the thing to dread about diabetes is really related to the complications that it gives rise to. And the longer you have got diabetes, the more chances you have to get those complications. One of the complications as the children or the kids as they would face is to be able to follow the recommendations, to discipline themselves enough. They would like to go to a party, they would like to stay out late. So those are the issues that we have to deal with very sympathetically, but at the same time reasonably firmly, with the entire future of the child in mind.
Well, time now for a quick break, but when we come back, we try and understand how type 2 diabetes can be prevented and managed. Stay with us.